Hello, everyone. Thank you for joining this session. I see time flies, so let me see how good I deal with this. So I'm going to be touching on targeting on both sectors, social assistance, the non-contributory regime of social protection, social security, social insurance, all of that is for another life, and also humanitarian aid, something that the World Food Program is actually doing in just so many countries, emergency response and humanitarian aid. How do we reach the right people? And I'm going to be looking at two countries. We've been looking at targeting data for Malawi for over many years, for over actually 12, 15 years. So I'm going to be presenting a light touch study on the correlation structure between poverty, food insecurity, malnourishment, and climate vulnerability. And then I'm going to be presenting a rigorous lean impact evaluation produced by other colleagues in WFP, Felipe Dunch, and I'm very lucky enough to have here one of the co-authors, Jonathan Garcia, from Humboldt University as well, who may be able to help me answer some of the questions on the DRC rigorous impact evaluation. So, Jonathan, be ready for some of that. All right, let's see. So what are we trying to investigate is basically who and how should benefit from both social assistance and humanitarian assistance. As the World Food Program, we're trying not to disrupt too much government efforts in delivering social assistance, social protection in their countries with our emergency response and humanitarian response. Who should benefit from social protection and humanitarian assistance continues to be a very hot topic, a hot debate. Sometimes it fades away, like in Latin America in the early 2000s, yet to come back later on and be questioned again, which is very healthy policy discussions around these issues. One key question we were asking ourselves is whether monetary poverty and food insecurity are correlated. What is the degree of correlation of that? And whether poverty, monetary poverty and malnutrition are also correlated, and whether monetary poverty and climate vulnerability is correlated as well. And this hopefully will inform how policymakers and practitioners are designing both their social assistance programs and their humanitarian assistance programs as well. There's a large body of literature on the social assistance regime of social protection and how these social assistance programs are targeting primarily, usually, the poor. I'm going to touch a little bit on that. But there is much less literature and evidence on how humanitarian aid and emergency responses are targeting, usually the food insecure as well. What we know so far is that targeting is very challenging in humanitarian settings. There's decreased funding now with the humanitarian reset and so on, the budget cuts. But I think Sam was mentioning this for Mozambique. We see largely homogeneous household characteristics in low-income countries and context of fragility and conflict. So usually just wanted to make this sharp distinction between social assistance targeting and humanitarian aid targeting and try to provide some ideas, food for thought on some of the findings we have. Social protection is usually covering for households idiosyncratic risks they face across their life cycle, risks when you're old, unemployment risks, and so on. But also serves redistributive purposes, meaning they also try and target the poor and trying to reduce inequality. Humanitarian aid, on the other hand, usually is trying to target households that are facing covariate, climate-induced shocks, usually, I say, not always, and usually targeting the food insecure. So the question is also, are the poor the food insecure, and vice versa, are the food insecure the poor, monetary poor in this case? So this is the paper, light touch correlation analysis we are just finalizing in Malawi. The paper is titled, How Social Protection in Malawi Reaches the Poor, Food Insecure, and Climate Vulnerable. We first went through a round of a correlation analysis between these national issues, and we also tested how accurate is the social registry in Malawi, the Unified Beneficiary Registry, in finding the poor, which is the main purpose of the social registry there, but also how accurate, precise it is in finding the food insecure, malnourished, and climate vulnerable. That side of how accurate and precise is they're using a proximity test actually for the social registry. I'm not presenting here, I'm just presenting the correlation structure of these issues. So we studied the correlation structure between these issues. We're using panel data from the Integrated Household Survey 2010, 2013, 2016, and 2019. It's basically just cross tabulations, logistic regression, and the correlation between these issues. These are the definitions or the metrics, the measurements of poverty, food insecurity, malnutrition, and climate vulnerability. Perhaps I won't spend much here, but maybe during the questions you can ask how are we measuring these different things. Just to say that the social protection sector in Malawi is targeting the bottom decile of the poorest of the poor, based on monthly per capita expenditure. They're using a proximity test formula, by the way, that approximates to a level of consumption or expenditure in this case, monthly per capita expenditure. So some of the findings here is between the correlation between poverty, monetary poverty, and food insecurity is that they're highly correlated. Monetary poverty is highly correlated with food insecurity. 84% of the ultra-poor households are highly vulnerable to food insecurity. So one of the messages we're telling the government, policymakers, and practitioners is that your social protection programs are already targeting and reaching the poor. Do not come up with another program that targets the food insecure, because we are seeing that the same poor family is also very likely food insecure as well. So use and strengthen your routine national social protection systems, and they may help you as well with humanitarian aid and emergency assistance. And also, so you see the monthly per capita expenditure and how these curves overlap very much. So the highly vulnerable to food insecurity overlap very much, and they fall below the ultra poverty line. This is in Kwacha on 2019 prices. The overlap between monetary poverty and malnutrition is much weaker. And we've seen in many of the impact evaluations of social assistance programs that social assistance programs, cash transfer mainly, but also in-kind transfers, are not really having an impact on nutritional outcomes in the families that they deliver. Usually, there's a few impact evaluations that show some significant impact on the nutrition outcomes. So this really puts a little bit of pressure on the government in case whenever they want to make their social protection programs more nutrition sensitive. It's a big challenge. The poor families and the food insecure families are unlikely malnourished. And we have different ways of anthropometric measures for malnourishment. We have stunting, severe stunting, and wasting. There's a 23% overlay between poverty and stunting, and a 23% overlay of ultra poverty and stunting. Meaning if we randomly find an ultra poor or poor family in Malawi, close to one third of that family probably, likely, will have a malnourished or a stunted child, basically. So this represents a bigger challenge for social protection policymakers. When we look at the overlap between monetary poverty and climate vulnerability, the key finding here is that climate-induced shocks affect both poor and non-poor almost equally, and you can see the rates of impact on droughts and floods. So they're affecting equally poor and non-poor families. And just as the findings is that 36% of households living in monetary poverty and 37% of those in ultra poverty are negatively affected by droughts, and similar rate for floods as well. When we looked at landslides, there was a very low overlap. Now, moving into the DRCA, this is a rigorous impact evaluation by colleagues in WFP, as I mentioned. They really look at the how. What are the targeted mechanisms that are working well for the country, in this case for WFP programs, humanitarian programs, in reaching the food insecure in this case. So this is a description on what colleagues did. It's randomly allocated 84 blocks between a proximity test plus and a community-based targeting. They were comparing both targeting mechanisms there. So some of the findings is that on coverage rate effects of both targeting mechanisms, the share of households within a community that are selected for assistance is what we measure for the coverage rate. CBT and capped, no quotas, may lead to higher selection coverage. This is kind of the theory what colleagues were expecting to see, that if you didn't cap the community-based targeting, communities would select a higher number of potential beneficiaries eligible for the social protection programs. Turns out that the community approach led on average to 11% less coverage than the proximity test plus, actually. So communities themselves selected a lower number of food insecure families. So you see the difference. On targeting precision errors, precision refers to the proportion of beneficiaries that are food secure. Both methods perform remarkably well, actually, in precisely finding the food insecure, with median inclusion and exclusion errors around 40-53% respectively. PMT marginally better precision compared to CBT. PMT plus leads to lower exclusion error compared to CBT. However, the difference is driven by the difference in coverage that we saw with the community-based approach that was slightly lower. Some ideas, some food for thoughts are coming out of these two countries. The dichotomy between extreme poverty and food insecurity may not always be helpful if you're a policymaker and a practitioner, not always. Poverty and malnutrition is less correlated, so this imposes a bigger challenge for the governments, who may want to make those social protection programs more nutrition sensitive, if that's the case. Social assistance is not only for poverty alleviation and redistribution, but likely, and by the same token, also directly reducing food insecurity and enhancing resilience to climate-related risks because of the overlap, because of the correlation. Getting into more of the political and program implications, social assistance is also helping governments achieve SDG 1 and SDG 2, zero hunger, simultaneously, yielding cost efficiencies in social and humanitarian policy. So this is something that governments can look into further. And finally, community-based targeting performs well against econometric targeting, the PMT plus, when identifying food insecure households. Since community-based targeting has a lower cost, it may serve as an apt tool in emergency context. So if in emergency context you don't want to spend the money with the proximity test and door-to-door household registration and targeting, you may as well likely use a community-based target, and you may get to the same results. So that's it. Thank you very much.